You deserve better. Think back to your high school health class. What exactly did you learn? I took mine during COVID, and all I learned was that concussions are a bad thing and that drug abuse is bad. That's it. Nothing remotely useful. I didn't even think about the content I learned in that class until my first year of pharmacy school. During my first year of pharmacy school, I took a class called Self-Care for the Pharmacist. It was about taking care of common conditions that don't necessarily require treatment from a professional like a doctor. Hence why it's called self-care or self-treatment. I realized that this is the information that I should have learned in high school. This is what I would actually use when taking care of myself in the real world. So, I'm adapting this information. I am going to create a series of videos that summarize what I learned in this class. This series is targeting an audience of high school girls, so the ages of 14 to 7 approximately, but other people can watch it too. That was just my intended audience. The original class was graduate level, so in order to design this series, I had to make a few changes. I will not be covering special populations like what we learned about in class, including pregnancy, geriatrics, and pediatrics. I may briefly mention some of these subjects, but I will not be talking about them. I will also not be covering some of the topics brought up in the class that I took, such as dietary supplements, STI prevention, and family planning. I may or may not talk about some of these special things in other videos, but not as part of this series. Simply too much, too broad of a scope, had to limit it. Also, I will simplify the content since this is intended for high schoolers and not graduate students. For example, there are 7 kinds of medications for constipation. We're not going to go through every single one of the 7. It's just too much. So, we're going to cover some other conditions though. Examples of some of the topics that we will be covering. This is not technically medical advice, it is general information to help you build your knowledge base about this topic. It is not tailored to your specific situation. You can consult with an actual medical provider for actual advice. This also isn't an endorsement of any specific medications either. We will be covering the medications used to treat things and what other non-pharmacological therapies that we can use. So with that out of the way, I hope you enjoyed this series and I hope you learned something.